Hello, everyone. My name is Leonardo Torrejon Peredo, and today I will be presenting my agenda setting assignment for counseling methodologies, behavioral and cognitive modalities. The professor of the course is Professor Heidi Weinisheimer, and today is November 23rd, 2025. Thank you for being here. Let's begin. Here's the roadmap for today's presentation. I will cover a review of the 7 cognitive behavior therapy agenda setting components, a critical comparison of 2 clinical videos, my preferred agenda setting style and rationale, and lastly, I'm going to be looking at common agenda setting difficulties and my strategies to manage them. First, let's review the 7 components of the agenda setting in cognitive behavior therapy. Agenda setting in cognitive behavior therapy serves a few key purposes. It maintains structure, it supports collaboration, and it keeps the work goal focused. According to Kinnerly, Kirk, and Westbrook, 2017, establishing structure early in the session reinforces predictability and emotional safety for clients, while also promoting efficient use of time. According to Kinnerly et al., in 2017, the 7 components of cognitive behavior therapy agenda setting are brief review of the past week, to identify major events without excessive detail, using summarization to maintain focus. The next one is review of the previous session, which allows clients to reflect, clarify points, and provide feedback. Next is assessment of current mood. It can be done formally using standardized measures or informally through questioning or rating scales. Then you're going to have review of homework or tasks. These may overlap with major topics. Terminology can be adapted. If homework has a negative connotation, it can have a different name. And afterwards, you're going to have main discussion topics. Here, you're going to be talking about symptoms, external problems, or CBT skills relevant to the client. Afterwards, you're going to have homework or assignments for the following session or next week. Here you have the option to negotiate during the session, what kind of activities you want to follow through with. And lastly, you're going to have feedback. This ensures clients share their perspective on what was helpful or challenging. Each of these components support continuity between sessions and ensures that progress toward treatment goal is consistently evaluated and reinforced. Now I'll compare how the 2 counselors on the different videos address the agenda components. I'm going to be moving into the evaluation of the 2 videos I analyzed for this assignment. The first video is by Dr. Todd Grande, posted on 2015, and the second video is from Qualia Counseling Services in 2017. Both counselors used agenda setting to structure their sessions, but they differ in the order the 7 components and in what they emphasize the most. Dr. Grande followed what Kinnerly, Kirk, and Westbrook 2017 described as a classic structured CBT sequence, very linear, goal-focused, and efficient. In contrast, the counselor from Qualia demonstrated a more relational and collaborative approach. The session had the same core components, but the order felt more conversational and guided by the client's emotions and emotional needs. So now I will look at each of the 7 agenda items and how they are handled in both videos. In Dr. Grande's video, he started the session with a clear structure review. Past week, mood, review of the previous session, homework, main topic, homework planning, and then there was feedback, but it was mostly implied. This structure supports behavioral momentum because each part flows directly into the next. However, while progress was evaluated well, his mood assessment and emotional focus were brief. Also, feedback was not explicitly requested, which could lead to misunderstandings or dissatisfaction that remains unspoken. So overall, his approach demonstrates the directive and cognitive focus style recommended in cognitive behavior therapy, according to Kinnerly et al. On the other hand, you have um, the Qualia counselor used a very different experience for the client. He used the whiteboard to co-create the agenda visually, started with mood and reflection rather than behavior, asked questions about how the client felt in the moment, encouraged the client to choose priorities. This made the session feel supportive and collaborative, which strengthens the therapeutic alliance. However, homework was not reviewed early or clearly. They did not discuss the homework that was given in the previous week. The counselor talked about the progress, but did not connect it explicitly to the previous task. If a client struggles with avoidance, this can contribute to less accountability and reduce skill transfer into daily skills. As CRP and colleagues 2024 emphasized, agenda setting is most effective when both structure and collaboration are present. Now I'm going to be reviewing the items one by one very quickly. Dr. Grand placed this as the very first item and he kept it concise. This keeps the conversation focused on progress and treatment direction. The Qualia counselor didn't cover the past week, but later as the fourth item, and with more space for the client's emotional story. This shows some important differences in priorities. Granted has a priority for structure and time efficiency, while Qualia focuses on rapport and context building. Next, we have review of previous session. Grande clearly linked the client's current progress to what they covered last time. This reinforces treatment continuity, while Qualia's approach was more reflective and allowed the client to make meaning from their experiences. So in both cases, the impact was positive, but for different reasons. Grande focused on behavioral results, while Qualia focused on emotional insight. Next, we're going to be looking at mood assessment. Mood monitoring is a very important part of CBT because it allows us to track symptoms change over time. According to Kinnerly et al., 2017, updating mood status should be a routine agenda item. Granted, did assess mood, but only briefly. There wasn't a scale or a deeper exploration of the topic. The quality counselor used a numbered rating scale, asked follow-up questions, and checked how the client was feeling about what they discussed. This supported better emotional awareness and risk monitoring, especially since the client was experiencing anxiety and depression-related symptoms. Then we have homework review. Reviewing homework is one of the strongest predictors of treatment success since it generalizes skills into daily life, according to Magnan and colleagues, 2021. Granted reviewed homework directly and assessed how successful the client had been. This reinforced skill learning and responsibility. Qualia did not explicitly review homework. Some reflection occurred, but it wasn't labeled or evaluated as an assignment. This may reduce motivation and behavioral follow-through. Next, we have the fifth item of the list, which is main discussion topics. Granted prioritized topics based on what impacted functioning the most. This improved efficiency and ensured progress. On the other hand, Qualia allowed the topics to develop more organically from client storytelling. While this enhances autonomy and emotional validation. It also risks too many issues, emerging without prioritization, which can dilute therapeutic focus. Next, we have homework planning. Both counselors planned homework, but in different ways. Granted, introduced homework early, but finalized it near the end, which could be rushed if time runs out. Qualia integrated homework naturally as they discussed goals, which improved the transition from insights to action. So Qualia style helped the client understand why the homework matters and supports motivation for it. Lastly, we have feedback. This is very important to prevent misunderstandings and maintain a therapeutic alliance according to New and colleagues 2025. Rand implied feedback by checking understanding, but he didn't ask how the client felt about the session. On the other hand, Quali explicitly asked for early feedback about the session and pacing, which improves collaboration, encourages honesty, reduces risk of alliance rupture, and this aligns strongly with patient-centered communication principles. Now we're going to be looking at at my personal preference and clinical rationale. Dr. Grant uses a highly structured and directive CBT style. He summarizes accurately, prioritizes efficiently, and connects homework directly to progress, which maintains strong behavioral continuity according to Kinnerly et al. 2017. However, emotional monitoring and explicit feedback are more limited, which may reduce rationale warmth. The Qualia counselor takes a collaborative and client-centered approach. He uses a whiteboard, monitors mood with scales, and invites frequent input, supporting alliance and emotional safety, which are key predictors of outcomes according to New et al. 2025. The trade-off is that prioritization is less structured and homework review is weaker. So both approaches are effective, but emphasize different strengths. Grande focuses on momentum and goal focus, while Quali focuses on engagement and client empowerment. The choice depends on the client needs and context. My preferred agenda setting approach is a hybrid style of both of the videos, but one that leans towards the relational and collaborative qualities demonstrated in the Qualia video. I value creating a counseling environment that feels warm, supportive, and emotionally safe, which research shows enhances therapeutic alliance and engagement according to New et al. 2025. I also appreciated visual collaboration, such as writing the agenda on a whiteboard, because it helps clients feel included in planning and maintains shared structure throughout the session. At the same time, I recognize the importance of structured prioritization to maintain clinical focus when necessary, a strength reflected in Dr. Grant's approach. Overall, the hybrid method fits my personality and values as a future counselor. I want clients to feel heard, empowered, and active in setting their own therapeutic goals while still being guided towards a meaningful progress. Here we're going to be looking at the styles across different settings. When choosing an agenda setting style, the clinical setting plays a major role. In private practice, a collaborative style similar to Qualia's tends to work best because the therapeutic alliance strongly predicts symptom improvement in longer-term cognitive behavior therapy, according to Wolf and colleagues 2022. In community mental health, attendance and engagement can be inconsistent. So a hybrid model balancing structure with report has been shown to improve retention and outcomes, according to Boss and colleagues on a 2023 study. In corrections and probation environments, accountability and efficiency are required. A structured approach like Dr. Grant's is useful, but report remains important to maintain cooperation, according to Saxena and Sahai on a study in 2024. For crisis or inpatient care, a highly directive agenda is essential to ensure containment and safety, which research is acute, which research in acute psychiatric setting supports, according to a study from Wood et al. And colleagues in 2022. And in school-based or youth counselings, trust and flexibility are key to developmental engagement. So flexible cognitive behavior therapy approach is recommended according to Kendall and colleagues on a 2023 study. Overall, adapting an agenda setting to demands of the setting is essential to support both engagement and clinical progress. Sorry about the noise. Just the settings influence agenda settings. So do client characteristics. For example, for trauma survivors and clients with attachment concerns, a relational quality of style approach supports emotional pacing and safety, according to Kendall and colleagues on a 2023 article. For ADHD or highly avoidant clients, a structured grand style agenda helps limit topic drifting and encourages behavioral focus. On the other hand, for depression or low motivation, a hybrid style is ideal, using structure for behavioral activation while maintaining alliance through empathy. For court-mandated clients, structure reinforces accountability, while relational support maintains engagement, according to Saxena and Sahai on a 2024 article. And for clients experiencing high distress or risk, frequent check-ins and emotion monitoring are critical, a strength of Qualia's approach. So the guiding principle is to match the agenda structure to the client's readiness, emotional needs, and functional demands. Now, a final statement of my professional identity. As I reflect on my emerging professional identity, I see myself as a warm, collaborative, and structured future cognitive behavior therapist. I value empathy and emotional safety, but I also believe strongly in the power of clear session structure to support meaningful change. At the core of my practice, I would have to believe that clients are capable of growth and improvement when giving the right tools, guidance, and partnership. Agenda setting helps me strike the balance between validating a client's experience and ensuring that each session moves towards concrete, achievable goals. By integrating relational warmth with evidence-based structure, my aim is to help clients feel supported, empowered, and hopeful as we work together towards positive, measurable change. Okay. Next, we're going to be looking at the difficulties and strategies of agenda settings. Now I want to reflect on 3 agenda settings difficulties that I believe I might personally experience as a new cognitive behavior counselor. These are based both on my style and on challenges highlighted by Kinnerly and colleagues in 2017. The first one is to put many items on the agenda. I tend to be very empathic, and I want to help with everything a client brings. But as Kinnerly and colleagues explain, trying to fit too many problems into one session can result in unfinished goals and can overload the client. The second challenge is difficulty prioritizing which topics to address first. I never want clients to feel rushed or unheard, so narrowing the focus can feel uncomfortable. But without prioritization, progress slows down and both the counselor and the client may become frustrated, which again is supported by Kinnerly and colleagues on it. The third difficulty is misunderstanding the true meaning behind a client's issue. Because clients may express concerns from a cultural or personal perspective different from my own, there is a risk that I might misinterpret what is most important, and that could lead to working on the wrong goal or demanding or it might damage the therapeutic alliance. So these difficulties do not come from a lack of skill or effort. They actually come from strengths like empathy, listening, and wanting clients to feel understood. They just need structure to guide them effectively. Some strategies for success. To address those challenges, I plan to implement several evidence-based strategies. The first is collaborative agenda negotiation. Instead of deciding what we focus on alone, I work together with the client to list concerns and choose or two priorities. According to Sirpi and colleagues in 2024, this collaborative approach improves clarity and leads to better outcomes during clinical visits. The second is context-informed prioritization. This means selecting the issues that is currently having the biggest impact on the client's function, taking into account their daily responsibilities and stressors. Magnan and colleagues in 2021 emphasized that when treatment goals align with the client's real-life context, engagement and satisfaction are much higher. These strategies help me keep structure, while still preserving the client's autonomy, which matters a lot to me. Excuse me. I also plan to use strategies that support communication and structure throughout the session. One is patient-centered communication that includes reflective listening and asking, what does this mean to you? This reduces misinterpretation and improves the therapeutic alliance, which Neo and colleagues in 2025 found to be strongly linked to better clinical outcomes. Another strategy is the use of visual agenda tools, such as writing the agenda on our whiteboard. This keeps the session organized and visible. As NSERPA and colleagues 2024 highlight that visual planning enhances transparency and collaboration. And finally, I will rely on feedback loops. By checking in mid-session and again at the end, I can catch any misunderstandings early and maintain a strong alliance. This approach is aligned with Wolf and colleagues in 2022, who found that feedback can prevent alliance ruptures and keep therapy on track. Overall, these strategies allow me to turn my relational strengths into effective cognitive behavior structure. To summarize this section, effective agenda setting blends structure with emotional validation. Prioritizing concerns helps clients make measurable progress. Understanding the client's narrative remains essential to honor their experience. Consistent feedback protects the therapeutic alliance and supports cultural safety. Agenda setting is a foundational cognitive behavior therapy skill that directly influences treatment outcomes, as emphasized by Kinnerly and colleagues. Ultimately, my goal is to develop an agenda setting style that is collaborative, client-centered, and strategically focused, so clients can feel both supported and empowered throughout their therapeutic journey. Thank you so much for joining in. I hope you guys enjoyed it, and if you have any questions, please feel free to reach out to me.